Let's just get started. Welcome. Thank you for joining the World Affairs Council of Connecticut to discuss building a resilient world with very special guests, Dr. Garcia, who served as the 14th Assistant Secretary for Health of the United States and 4-star Admiral in the U.S. Public Health Service. He was the highest ranking medical officer in the United States. So thank you so much for joining us, Dr. Garcia.
No, thank you. Thank you. And thank you for inviting me.
So as you all know, you're here for a conversation between Dr. Garcia and Megan Torrey, CEO of the World Affairs Council. By way of brief introduction, Dr. Garcia served as the 14th Assistant Secretary for Health of the United States and as a 4-star Admiral in the U.S. Public Health Service, positions confirmed by the Senate. As the highest ranking medical officer in the U.S., he served as the primary advisor on matters involving national, public, and global health and science for Secretary of Health. Dr. Garcia has held positions including as U.S. Representative to the World Health Organization Executive Board, Deputy Director of the Pan American Health Organization, President and Dean of Medicine for the Ponce School of Medicine and Health Sciences, as well as Commissioner of the State of Connecticut Department of Public Health. So very familiar with Welcome back, if virtually. Dr. Garcia currently serves as the CEO of Ambitna and Chairman of the Board and Chief Health Strategy Officer of Ageas Health Analytics. Dr. Garcia, we're so glad you can join us today.
No, thank you very much for the invitation. And you have a very beautiful background as well as Megan. Megan looks like she's in the United Nations building right now. And you look like you're in House and Garden, Samantha.
It's been a lot of internal time in this quarantine. And so now let's just get started. I am pleased to turn it over to you, Megan. Megan Torrey, CEO of the World Affairs Council.
Thank you, Amanda, and thank you to everyone who's joining us today. And I want to give a special shout out this morning or this afternoon to Yvonne Davis, who is our friend and Dr. Garcia's friend, for making today possible. Dr. Garcia, thank you for joining us again.
Thank you, Megan. Thank you very much.
So we're so pleased to have you. We know that you are familiar with where we are in Connecticut, and you have been a great supporter of the World Affairs Council, not just ours, but many World Affairs Councils across the U.S. So we're going to talk to you today about building some resilience. And as we sit here, we know that around the world, there's about 9.6 million confirmed cases of COVID-19. We also know that almost 500,000 people have been killed by this virus. And given your extensive background, we know that you consult a lot and you're in demand. And in fact, we're lucky to have you with you today because you almost had to be on the Hill today, but you were there yesterday. Can you talk to us a little bit about what you were doing in Washington yesterday?
So yesterday we were doing two very interesting things, and I think it's very pertinent to the resilience of a community and of a country. When we're doing clinical trials in our nation, minorities, women, African Americans are underrepresented. And so essentially we have been working with Ambitna and a couple of other universities, including Meharry Medical College, which is in Nashville, and it's a traditional African American college, a Black college, that essentially to try to accelerate the inclusion not only of women and African American and Hispanics, but bring the communities also in the clinical research. And this is very important because if you have clinical trials and you don't bring a representation of our communities, when the drug comes to market, really doesn't show the effect that it was shown in a biased population. So that was one thing that we were working. We were very excited. That essentially was during the entire morning. The afternoon, we took to talk about public health surveillance and essentially how to help communities with that. We are concerned in terms of opening our country to commerce and trade and transportation and other things in different venues, but we want to make it very safe. So I don't want to use the word tracing because it has a very bad connotation like Big Brother, but essentially what we are looking is to find applications or technology that can help the public health infrastructure at the community level, at the state level, and the national level to be able to understand better where we are, not only with COVID, but epidemics that will come in the future as well. So it was a very exciting day. It was a little sad for me also to see DC completely empty. I know it gets very active in the evening, but it was, the restaurants are starting to open now. So we want to help them also that the virus doesn't affect more communities.
So thank you. So when we're looking at trying to, build a plan, build resilience into our communities, into our state, into our nation, and of course the world, we oftentimes look to a crisis in the past. And we know that, you've got this great career. And so you've been, in this field during the crisis of Ebola, HIV, AIDS, MERS, SARS, and if I recall correctly, here in Connecticut, while we were experiencing anthrax scare, what sort of lessons have you learned from those experiences?
So I would give two examples, and I really don't want to talk about me, but I also want to talk about my team in Connecticut. So when September 11 happened and we were concerned that bioterrorism will come to our nation, we were thinking it can be foreign or it can be domestic. So we started a system of surveillance with our hospitals as partner and as our local health departments and our state lab. And what we were able to do, we were the first state to identify anthrax within 12 hours, within less than 24 hours. That's significant because all the other states affected, they took them 2 months to 3 months to have it because they were not using the correct public health syndromic and surveillance system that we created. And that was actually my team of epidemiologists, and essentially we worked very closely to convince people that this was the right thing to do. I think that has changed the way the world looks at epidemics and pandemics because the syndromic surveillance is one of our mainstays. The other thing, and I don't know if you're aware of this, I work very closely with the WHO and the Department of Health and Human Services and essentially the State Department, the US State Department, to create international health regulations. This is the biggest and most protective regulation that has been created. It was signed by 196 countries in 2005, and it was essentially put into action in 2007. That's the basis that we have right now when an epidemic starts in a country and it's going to move to other country, so we can actually protect both countries or a region, like for example, Europe, Africa, the Americas. So I think these are the two examples. I have a lot of other examples, HIV and so on and so forth. SARS, for example, I was very involved in Canada when SARS happened. And by the way, SARS and COVID-19 are cousins. And SARS actually had a higher mortality rate as an average worldwide. It was over 10%, but only 800 people died, 8,000 people. And there were two things that were done extremely well. First, we had social distancing and also protection of the communities. That's one. And then the other thing was that the virus, we were lucky that it takes much longer and in the inner part of the lungs to affect versus COVID-19 that stays in the nasal area. Worldwide, we have a 5% fatality rate, and except in Italy, that we have a very high percentage in Italy, close to 14%. So I think that based on the conversation that we had, you and I and others, is that we had to make sure that we understand the capacity that we have in our countries and our states and our counties and our towns in terms of not only in terms of government and governance, but in terms of what our communities have that they are strong and what are the areas of need. And be able to prepare them to absorb, to actually deflect when a crisis happens, but more importantly, to learn from that crisis so they become very resilient. It's funny, years ago, when you talk about resiliency in medicine, means mental health. And mental health is one of the components that we have to really look into our communities, because it took me, honestly, a couple of months to be able to come out of the building just to bring my dog out. That's the only thing I was doing, and going to the supermarket. I even have to have a haircut when I look like a lamb. And so I think that if you have a support system that can help you when you're isolated, like most of us we were. But going back to your question, I think there's a lot of lessons learned. I think this time public health that has been put on the forefront has to not only ask for resources, that's always good, but what they have to do is get what you're doing, lessons learned, put them together, share them, because in health, we are not good sharing information. Let's share the information, what we have learned with all our communities and all our other states and all our other countries and work together. And I think we will be a resilient world and a resilient country as well.
So staying on that for a second, so you know, you talked about a little bit of how COVID-19 was similar to SARS. When we're looking at how the pandemic, you know, is happening and how the world is experiencing the pandemic, in what ways is COVID-19 similar to things that we've seen in the past? And in what ways is it a little bit different?
So it's similar in one thing that COVID, like many other pandemics, comes from a zoonosis. The coronavirus, they tend to coexist with bats. And then if you have a feline or a cat or a bird, then actually it can mutate and then be able to affect people. We have to understand that there's economic conditions, social conditions, and also cultural conditions that actually help, and environment as well, help the zoonosis come into our ecosystem of living. And they are very similar, both of these coronavirus, and in terms of that. As a matter of fact, when we're looking at SARS, it's both of them almost have the same name. But what is different in between these two viruses is that this COVID-19 is more aggressive. The other thing is where you keep the virus as a human is in your narrow nasopharyngeal area. So it's easy for me to communicate it to you. That's why we're talking about social distancing. In WHO is using 3 feet. We're using 6 feet here. It's considered that in Italy, because I don't know if this is true or not, but these are the reports that have been, that because they talk louder and essentially they are more vocal, it goes even farther, and that's why they have a fatality rate of 14%. But that's a big difference. The other thing is the symptomatology. Even though SARS was more lethal as an average, it was less likely to be communicated in between one person and the other. But I think what we have to learn, this is a cyclic process that happens in our environment, in our ecosystem. So we should be prepared for the next one, not only about the next wave, if it happens, if it doesn't happen, because this virus might mutate as well. It might be second, third wave. We don't want to speculate on that, but we have to learn what happened now and prepare ourselves for the next one. And you can see, this is not for the hospitals to be the only players here. This has to be everybody. The issue with the toilet paper, I mean, that became a big commodity here in this country. So I think that we should learn that we should have some reserve at home for basic things that we need, but at the same time, I have truthful and impactful communication from the public health agencies globally and here in the US. And in Connecticut, for example, you have a very strong infrastructure there. And one thing, and I know that I'm talking a lot, Megan, so I apologize for this. One thing that I was looking in the numbers of WHO and the numbers of Johns Hopkins and the numbers from the health department in Connecticut, when you look at the population of African Americans in Connecticut, their fatality rate is 4 times as the white population in Connecticut. It's actually 3 times more than Hispanics in Connecticut as well. And I think we should, after this epidemic stops being in the news all the time, that's a population that we have to help in our country. I know that they're talking about social issues, but social issues start with education to the moms and essentially help to the kids and the families in our inner cities. And I think that's extremely important because there's many hypotheses right now that have been floating around. One of them is the vitamin D levels in African American is lower than the rest of the population. And we know that vitamin D helps against the essentially the storm that happens in our lungs. So, and it's activated by sun, but if you don't have enough in your body, then it's not going to help. So that goes back to what I was mentioning in terms of the children, education and health for our children in inner cities. In this case, I mean, when you have 12% of our population is African American, 12.5%, and you have over 25% of the death of Americans in our country are African Americans. That tells you right there that there's inequity and there's some significant health disparities. And this goes beyond health disparities now. This is a big challenge that we have to resolve right now.
I think you make a good point. A few weeks ago, we held a community-wide forum on race resilience and the community, and really, talked a little bit about how, we need a holistic approach in health and access to health care, prenatal care. A lot of that has, needs to be tied in. Let's stay on that just for a second. So if you're looking at how do we build resilience within that community, within all of our communities to make for, equitable access, what are some of the things that you would do?
So I'm going to give you a data point here. When I was the director of health in DC, so we had one of the highest infant mortalities in our nation in the District of Columbia in Washington. And we did campaigns to educate our parents to avoid certain things, including co-sleeping together with a baby and so on and so forth. But there was just really not strong studies in terms of the difference what were happening. If you know DC, the more to the east that you go, the more poor the community is, and the more African Americans are. So when we did our campaigns, we lowered the infant mortality rate, but that was a fake number because essentially in Ward 7 and 8, which are in the eastern part, where the African American have the highest concentration, there was no change there. The change happened in the wards where the Hispanics and the Caucasians live. So that goes back to, we have to understand our communities. We have to understand their strength and the areas of need. And instead of doing a shotgun approach to our state or our counties, or we have to go town by town to identify what we have. I talked with Yvonne the other day, and when they are talking about social distancing, I live in Avon. By nature, in my neighborhood, there's social distancing in between the house that I had with the other house. When you live in the inner city, you're in a building that there might be 300 people living close to close, and you don't have the access to things that you have in Avon or in Greenwich and other areas of Connecticut. So you cannot have and I'm not criticizing Connecticut, I'm just giving an example. And we have the same thing here in Chevy Chase. So my point is, understand your community, understand their strengths and their needs, and essentially get champions within the community that actually can communicate not only with the leaders of the state and the towns, but also the leaders of the nation. I think this epidemic shows up shows us that you cannot have just one agency, a federal agency, taking command and control of everything, because it doesn't work like that. You have to go states and counties and towns. In Connecticut, we're more about towns and then the state, but I think that that's going to be the game changer. I can go with a hypothesis. I mean, when you look at the countries, you see the number one most resilient country in the world in terms of economics is Norway. And the US is in the top 25 in the past 10 years, as well as Australia and the UK. But when they put US by regions, and there's some regions that are higher than other regions. But if you go by towns or by states, it's a complete big difference. And I think that that's why we have to get to know who we are. It's like a football game. If you think everybody's a quarterback in your team, you're going to lose every game, because you have to identify what are the strengths or weaknesses of every player in your team, and then be able to move forward and have a plan of action.
So when you're, keeping with that analogy, all of the players on the team, you were the United States representative to the WHO. Can you talk a little bit about the importance of international cooperation and the role of the WHO, specifically within this pandemic?
I think it's crucial. I know that there's a lot of politics in the game related to WHO and the UN. I'm not going to go into that. But the one good thing that WHO does better than anything else is they identify the data from the country. So they have people embedded in every country that help work with the ministers of health. I'm going to give you the example of the Western Hemisphere. Every country in the Western Hemisphere has an office of the Pan American Health Organization, which is essentially the Western Hemisphere office of the WHO. And I was in charge of that, okay? So essentially every minister of health will have a team from WHO working with them, be able to strengthen the data collection, surveillance, and planning for them to be more resilient. In other regions, we don't have the same luxury. Africa is one, Asia is another one. But I think WHO is a great partner, essentially, to work with our ministries of health internationally to show them best practices so they can actually learn. If you're a poor country, and if you get a wealthy country to tell them what to do, it doesn't make any sense, because if you don't have the capacity, neither the human resources, neither the technology or the finances to be able to do that, it's like you putting a poster about a nice movie that doesn't have to do with what I want to watch that day.
So while we're in the midst of this global pandemic, I think that people have said this is far from going to be our last global pandemic. And so when we're looking at the next big one, whatever that big one will be, what would you suggest we can do as individuals, as states, as nations to sort of build resilience before this next event happens?
So I might surprise you with the answer that I'm going to give you, but we should be looking right now at the environment. We should be looking at water. We should be looking essentially at the food supply that we have. 1/6 of the people in this world only have 1 meal or less per day. We keep increasing the population of the world. So we keep cotton, for example, and soy, which are very important for our economies. If you grow cotton or soy, you cannot use that soil for 20 years. So think about that one. If we're X amount of billions this year, and then we are X amount of billions of people 10 years from now, and so there's less land that you can use, there's going to be less food. You combine that with the next zoonosis that is going to happen in the next pandemic, and you have a catastrophic event for the entire world. So we cannot only look at viruses, and we cannot only look at medical technology, and we cannot look at it. Let's have all these equipment. What we have to really work is repairing all our challenges that we have globally. Hunger, water supply, and food supply are big time things. For me, and again, this is not talking about pandemic, education of children, health of children, education of mothers. You have education of mothers and children, and that's the best predictor for economic development in any country in the world, and also the health of that community. So I think it's multifactorial, so I don't have a perfect solution. It's not I'm not giving you the perfect answer, but I'm telling you essentially what's happening right now. I mean, the beauty of being in the positions that I had been from Afghanistan to Africa, had been from Haiti to essentially El Paso, Texas, I've been from Puerto Rico to very beautiful countries. I mean, I had an office in Switzerland, so that's pretty cool, huh? Geneva. But you see the contrast in terms of education, knowledge, access to food, access to treatment. I remember going to Nicaragua once, and the patient had to put their own antibiotics because they didn't have enough nurses. So we're talking about the pandemic, and we want to have resilience. And I think I applaud you for that leadership that you have and everything you have achieved. But I think that maybe you are the best person right now to bring all these other leaders from all these other areas, because it's not only health. You have to do transportation, education, communication, and essentially the food industry. Look when people don't talk about this. I come from a farm, a dairy farm. When the epidemic started, the dairy farmers in Puerto Rico were actually throwing the milk out because there was no people picking up the milk. So there was a scarcity of milk, and there were no employees actually to be in the food chain to be able to move that. So even the food supply gets affected. So I think you are in a unique position. I mean, and you have all these flags in the back. That I only have one flag here. This is my flag, but
it's an important flag, though.
But my point is, if you you have the power of conveying people into a place and discuss the big minds together. I think you will be able to make them aware, because sometimes you will be surprised. People with a lot of successes in life, they only see what they have in front of them, and they don't realize this is a complete world that is connected as a big ecosystem.
Dr. Garcia, we are out of time today, but I thank you so much for joining us, and I hope that at some point in the future we can welcome you here in person back in Connecticut.
I'm looking forward, and thank you very much.
Thank you.
Well, I just wanted to thank everyone one last time. Thank you so much to everyone who joined us. Thank you, Garcia, Dr. Garcia, so much for being here with us today and sharing your history of expertise and how we can move forward from this pandemic, a more resilient, strong state, nation, world. One last plug before we sign off for everyone. I just want to encourage everyone joining us today. If you want to revisit this conversation, please go to our YouTube channel, which is World Affairs Council of Connecticut on YouTube, and you can subscribe there, get updates. You can listen to this conversation again and all of our other episodes. So thank you again. Thank you everyone for joining us today, and we'll look forward to seeing you next week.
Bye-bye.
Thank you so much.